My name is Jean Wu. I'm the co-program chair for 2015 and the incoming president for the Academy of Microscope Enhanced Dentistry for 2016. I have here Dr. Dennis Shanelec, world-renowned micro-periodontal plastic surgeon. I want to ask you, Dr. Shanelec, how has microscopy impacted you in your practice and changed your dental approach?
I started using the microscope 20 years ago, and I had practiced 15 years as a periodontist with just low magnification loupes. And the change in my career was profound. It was a change not only in the improvement in the outcome of my treatment, but also in both the satisfaction that I had with the practice of dentistry, the physical effects that it had on my body, and the ability to practice comfortably for a long period of time, and any recognition that I might have as someone who is striven for excellence in periodontics is directly the result of the fact that I began using the microscope 20 years ago. I practiced for 15 years without the microscope, and I think that I was a good periodontist, but I certainly wasn't a periodontist of world-class caliber. And I attribute the advances that I've made in my career, in the satisfaction of doing dentistry, and in any small degree of recognition that I've had as being someone who really represents excellence as the microscope. That's what the source of my both inspiration and accomplishment is. So that's how it's affected my career. And it's also made me have a lot more longevity, I believe. Yes. So thanks for the question.
Well, thank you, Dennis. And I think some of the techniques that you utilize are especially important with the microscope, because I think without the microscope you can't do the smile technique. You cannot really achieve the results that you've achieved. So would you say that the success rate that you have with your techniques are a direct relation to the microscope, and how would you see us conducting perhaps research to prove that standards and success rates are really changed with the use of the microscope?
You know, that's a very good question, because, you know, periodontics is a very skeptical field, and whenever something happens or a procedure is proposed, the obvious question comes up of where's the research, or what is the evidence? Of course, with the microscope, the evidence is before your eyes all the time, and the effect is so dramatically superior that it's really hard for you not to really draw conclusions from it. I think that there's probably room for research, but as you know, anyone who takes up the microscope, they immediately know. They don't have to have evidence to see the decay that they hadn't seen previously. They don't have to have evidence that their margins are 100% better than they ever were.
Right.
Overnight.
Yes.
You know. So I think it's true that there is room for evidence, but for the individual practitioner who is contemplating using the microscope, I can tell you that the evidence will be there on your first day. And if you want to advance the field with some studies, that's wonderful too, and I think people will do that. Another generation besides mine.
Well, I hope that we can affect some change and maybe get it to the faculty of the dental schools and allow the students to see, because they may not have the opportunity of seeing that earlier on in their career, and I wish that we could get it into the schools and start at the beginning of their.
But it's not too late for anyone, because, you know, I practiced as a periodontist for 15 years without the microscope, and the effect that it had on my practice was monumental from my personal standpoint. And it was actually somewhat of a surprise that I was recognized for excellence. I just assumed that that's what everybody wanted.
Right.
And when the microscope came about, I was able to accomplish what I was trying to do all along, but was hampered. So, anyway.
Thank you. Well,
welcome.
we and patients, thousands of patients, appreciate what you do, and I hope we can continue your legacy and continue to teach and pass on the knowledge.
You are doing that.
Thank you.
Thank
Thank
you.
you very much.